Well, hello. I hope you're having a great day wherever you are in the world, and thank you for tuning in. Today is December 28th, 2022. Tomorrow, I'm going to be having hand surgery, specifically carpal tunnel release surgery on this hand, this wrist, to alleviate the problems that I've been having in that hand for about 8 or so months, and I'm sort of documenting the experience. What I'm going to do in this video series is, first of all, I plan to, in this video, I'm going to sort of talk about the history of my injury issues, as well as things that I've done to try and treat the injury. After that, I'll make another video probably here in the coming days, maybe weeks, following up, documenting the immediate experience after surgery. What was it like in the days, hours and days after the surgery? What was that experience like? And then ultimately, of course, I want to document the long-term recovery process and what was that experience like? Ultimately, I want to be able to answer the question, was the surgery worth it? And the goal being to help anybody, but especially other archers, compare your situation to my situation, see if it's something that I'm not recommending surgery or not, but in the sense of just assessing your situation, looking at how I did, and then using that as a data point for evaluating your own life and your own situation. So I hope that it's helpful in that regard. So what I'll do first is just start off talking about my injury and how I got it, and the treatment that I've attempted. So it started in April of 2022. I was in Yankton, South Dakota, for USA Archery's Field Nationals competition. I was there also to try and qualify for the World Games to represent the United States in the barebow division. While I was there, I got there maybe a day and a half ahead of time, I think. And first day, I had been practicing quite a bit. This is probably the greatest number of reps I've ever had for a month-long period leading up to this. But I never had any issues. I've never had carpal tunnel syndrome a day in my life prior to this particular day. So I got there, I practiced quite a bit the day before. I was still kind of working out some last minute issues, not to get into the details of field archery, but there were still a few technical things that I was working on. The morning of the competition, so about 5 o'clock in the morning, I woke up and my hand was just completely numb. Not only was my hand numb, actually my whole arm was numb, and that really freaked me out. Like, I was like, oh my God, am I having a heart attack? Like, what's going on? Of course, I didn't. I'd woken up kind of early. I was planning to get up, I think, at like 6. It was like an hour earlier than I intended. And obviously I didn't get any sleep, worrying that I was like dying or something. The numbness did go away, first in the arm, and then in the hand. Probably took about an hour, and I was still kind of feeling it actually when I went out to the practice range that morning to warm up. It finally got to where I wasn't noticing it at all after warm-ups, and when I got out to the actual competition range, I forgot about it. The next day, more or less the same thing. I don't recall whether I had a full arm numbness or not, but definitely in the hand, definitely was an issue for the rest of the competition. Some weakness definitely bothered me. I got home after the competition, and it was something I knew I had to figure out. So I wore a wrist brace for a while, especially like to bed, because I noticed that when I got up in the mornings, that was a lot of times when I had the really numb hand. And then as the day went on, my numbness kind of went down. I even competed in May 2022 in the Gator Cup. I actually wore a wrist brace during that. It was flaring up quite a bit. During this period of time, for like the next 3 months or so, 2 to 3 months, I rested quite a bit. I didn't shoot very much, 1 or 2 days a week. I really tried to take time off to try and rest this issue, because my goal was to shoot at Outdoor Nationals in August. So that was what I was kind of focused on. Unfortunately, it was interfering with my practice, so I wasn't able to practice nearly as much as I wanted to. It was always a balancing act between, okay, how much should I be practicing, and how much is this going to affect me tomorrow? And it always affected me the next day. So I didn't practice a ton, but it still didn't get any better, even with the wrist brace that I was wearing, sometimes during the day, usually at night. So I finally went to a orthopedist in the lead up to Nationals, so probably like a month before Outdoor Nationals. And the doctor gave me a steroid shot in my wrist, prescribed occupational therapy to me, which occupational therapy is basically, in layman's terms, is basically physical therapy. There are definitely differences between occupational therapy and physical therapy in terms of the focus and the types of things that they do. I'm not an expert in that area, but it's been described to me several times. But anyway, occupational therapy, physical therapy, whatever you want to call it. Went to that for about a month, maybe 3 weeks before Outdoor Nationals. I was basically I told the doctor, I was like, look, just get me through this competition. Shoot me up, do whatever we can do to get me through the competition, and then I'll do whatever you want. I'll take time. I'll take as much time off as I need. It's the dead season after that. It's the off season, so I'll do it. But just get me through this competition. So he gave me a steroid shot, prescribed me the occupational therapy, which I went to a couple days a week, and that actually worked. I definitely noticed a difference after the steroid shot. Occupational therapy, I think, was helping, and I upped the practice as well, probably for 2 weeks beforehand, which I know that doesn't sound like a lot, which it really isn't, but maybe 2 weeks beforehand, I did start, I was able to practice, 4 or 5 days a week. For at least an hour at a time, sometimes several hours. Went to the competition, came back, and rested. I rested probably for a solid 2 weeks, I want to say. No shooting at all. Took that time off to try and get better. Incidentally, the doctor never told me, you got to stop this. You got to take time off. I never have, even now, I've not been told to stop. Take a bunch of time off, with one exception, which I'll talk about in a minute. The carpal tunnel, though, from that point forward, has never gotten better. I noticed the initial improvement prior to Nationals, but since then, and despite not shooting very much, I took 2 weeks off, and then after that, probably shot about once a week, I would say, on average. Usually I'd try to take time off, but usually I'd make it maybe till Sunday. Don't have to go to work, so I would go and shoot for a while. Even with that level of rest and going to occupational therapy, I was going to OT for another probably 2 months. During that time, I went and got another steroid shot. This time he was like, all right, I'm going to give you a lot,
and we're gonna do an ultrasound. So I'm gonna deliberately stick the needle in like the nerve sheath in there, and we're just gonna shoot you up good, and we're gonna try and break up some of this. If you've had it this long, you probably have some scar tissue, so we'll see if we can break it up that way. I did that, and by the way, I basically didn't. The most painful part of that was the injection to numb me. After that, I felt no pain at all during the procedure, I guess you would call it, the injection. After the injection, in the weeks after that, no improvement, no improvement whatsoever from that injection. And continuing to go to occupational therapy. That was maybe a month after the nationals, so like sometime in September. No improvement at all. Continuing to go into occupational therapy. Waited like another month. I went back to the doctor. I also had some elbow pain. When I was really getting up there in the reps, I started to have a little bit of pain in the elbow during draw, and also noticed some crunching. In the elbow, crunching and popping. But it was on the outside of the elbow. The outer portion of the elbow. The nerve that runs to your hand is on the inside, right here. The funny bone, some people call it, is on the inside. So he was like, I don't think you have inflammation in your elbow. I think it's carpal tunnel, is what the doctor had told me. But I was still kind of skeptical because, I'd woken up on that first day, my arm was completely numb. Another thing I forgot to mention was about 2 weeks before field nationals, I had been working out pretty heavily for like 2 months, and like literally like 2 weeks before field nationals, I was doing curls where you're leaned back, kind of I guess it's an incline bench curl, and I'm curling, and biceps curls, and I curled once, and that was a tweak to my neck. I felt a little, jolt or popping, whatever, sensation in my neck, and my neck was very stiff after that. It was very difficult to continue working out. And I was still feeling that stiffness actually in Yankton. So I thought, maybe it's all the way up here that's the problem. So at that third doctor visit, the doctor gave me another steroid injection, this time in the elbow, to try and clear some of that up. But he's basically saying, this doesn't work. It's probably about time to start talking about surgery. I can't give you any more steroid shots because this is now 3, and it's just too much steroids. Too many steroids, too much steroids. He said too much steroids, so I'm going to go with that. So that injection had no effect. Occupational therapy, despite continuing basically that same type of schedule, not lifting weights either during this period of time at all, that just didn't get any better. I mean, I just continued to be the same. I wouldn't say it got worse, but it did not get better. So then I went and had something called a nerve conduction study, which is where they hook you up to some machine, and it kind of measures the electrical signals in your nerves. And I wish I had done that sooner because it really clarified some things for me. It clarified for me where the issue actually is in my body. I had thought, maybe it was the neck, maybe it was the shoulder. I have had 2 shoulder surgeries on the shoulder about 15 years ago now. And that can potentially cause issues. And then also I had the, pain and popping and stuff in my elbow, and that plus the arm being numb that first morning gave me concerns that maybe it's higher up. So I specifically asked him to test me, all the way up, and I had no issues anywhere except for the wrist and my hand. He was like, yep, you got carpal tunnel. There is definitely a slowdown of the signal through your carpal tunnel. And so, but I'm not seeing anything anywhere else. So that was good news, actually, because it isolated the problem, and carpal tunnel surgery, which is kind of the reason we're evaluating this to see if carpal tunnel surgery is the way to go. Carpal tunnel surgery is a fairly
I don't want to say minor. I don't know if minor procedure is the right word, but it's not as significant as some of the other surgeries I've had. They don't even put you under for it. It takes about 15, maybe 20 minutes. They make a little incision in your hand, wrist area, and they just cut this ligament that runs over the nerve here. So there's a ligament in there, and that's really what causes carpal tunnel is the nerve running along this in this tunnel, and it hits this ligament here, rubs against it, and that's what causes the inflammation and the numbness. So they just basically just cut this ligament, and that relieves the pressure on the nerve and allows it to no longer be inflamed. So it's a fairly minor, straightforward procedure, like I said. And based on everything I was reading, I was like, you know what, the goals that I have, could I take several months off and would this get better? Maybe. And I mean completely off. I mean no archery at all, possibly no weightlifting at all, like no exercise except for like cardio. Would that work? Maybe, probably. But how long would it take? I don't know. So 3 months, 6 months. And the thing is, I have goals this year, this coming year, 2023 and beyond, 2024, that taking 6 months off completely and then having to relearn skills, which is really what you have to do if you take that much time off from some sort of activity like this. Relearn skills, and then go and compete a few months later is just not really feasible. It would prevent me from being able to accomplish my goals. Not only that, it would possibly not work. I don't know how long it would take. And then once you're not feeling it anymore, you wonder, are you going to exacerbate it if you go back to it? So because of my plans for the year 2023 and what appears to be the relatively minor nature of the procedure, I felt that it was the right time to do this. Now, I have been a little trepidatious about it, just because, I have had several surgeries in my life. I've mentioned the 2 shoulder surgeries that I've had. I've also had a wrist surgery on this wrist from breaking my wrist about 3.5 years ago playing basketball. Not quite 3 years ago, actually. And I've had back surgery. Deviated septum from when I was a Sea-Doo accident where I was being very stupid when I was 18 years old. And then most recently was the back surgery. And, I don't regret those surgeries. Maybe one of the shoulder surgeries I might say I regret. But the more recent one, no. It's definitely been helpful. Those surgeries were necessary. I needed to have those surgeries. So I'm glad I did them in that sense. However, I've had enough surgeries to know that if you do have surgery, you are never going to be exactly the way that you were prior to sustaining the injury. Definitely true of my back, definitely true of my shoulders, definitely true of my wrist. Every single injury and my nose. Definitely true of every experience that I've had. I've had enough of these operations to know that you are basically leaving some parts of your body on that operating table when you have surgery. And they are, in fact, they're cutting a ligament. So, like, what effect does that have on your, life going forward? It's a question that I asked, and I was advised that people don't have issues with, hand stability or, it seems a little strange to me because, the ligament presumably has a purpose, right? It's there for a reason, or it probably wouldn't be there. But it's not. My concerns were. I was assured that was not going to be
a big problem. Virtually everyone who has the surgery says that it was a tremendous relief and tremendously helpful. And so it's a surgery. It's essentially, it's a surgery to help me come back to athletics faster, I guess is the best way to put it, because archery is an athletic activity, a martial art, and the whole point of doing it is to help me come back faster. Could I possibly heal completely without having the surgery? Yes, but it would blow things up for me long term. So I'm going to go ahead and have the surgery. Like I said, it's tomorrow. I'll document some more. I'm actually going to go shoot today. I'll probably take a little video of that as well. But yeah, we're going to have this operation tomorrow, and I will see you in the next video. Thank you for tuning in. I hope that so far this is helpful for you. Thank you.